Okay, good morning, everyone. All right, let me say good morning again. Is anybody awake? Good morning. Good morning. All right, we're going to go ahead and call the Business and Professions Committee to order. We're going to go ahead and begin as a subcommittee. Let us first start with our first author who signed in. That is Assemblymember Cooper. Mr. Cooper will be presenting on file item number 12, AB 2592. Mr. Cooper, when you're ready.
I want to thank the chair and committee staff for working with me to make this bill better. I will be accepting the committee amendments. AB 2592 is a prescription drug abuse prevention bill. The intent of the bill is to keep prescription drugs out of the hands of young people. Prescription drug abuse is arguably the largest healthcare epidemic in the United States, and recently in Sacramento we've had a number of overdoses. Drug overdose rates have more than tripled since 1990. Prescription drug overdoses now kill more people than car accidents. The Centers for Disease Control reports that 70% of these scheduled medications are obtained for illegal use from a friend or relative, and more frequently from their medicine cabinets. Yet the CDC has also reported that fewer than 3% of households lock up their scheduled prescription drugs. A study by the Partnership for Drug-Free Kids found that one of the key drivers for abusing prescription painkillers among teens is the availability and easy access. In the Sacramento area, which includes portions of my district, 42 overdoses and 10 deaths have been blamed on the prescription painkiller fentanyl. AB 2592 establishes a pilot program to measure whether increasing safe storage of opioids reduces the number of accidental poisonings among young people and reduces the overall prescription drug abuse rate among teens. The Department of Public Health would administer the voluntary pilot program and award grants to participating pharmacies in areas with high rates of prescription drug abuse. Finally, the bill requires a report to the legislature and sunsets a program on January 1st, 2020. I respectfully ask for your aye vote. And with me is John Winger.
Thank you. Please, testimony and support.
Yeah, thank you, Mr. Chair and members. John Winger with Slow Higgins Jensen and Associates on behalf of our client, Gatekeeper Innovation. We're happy to be here in support today. The idea for this bill came from legislation that was passed in Illinois last year. The proposal seeks to implement a pilot program to measure whether increasing safe storage of opioids reduces the number of accidental poisonings amongst children and reduces the overall prescription drug abuse rate amongst teens. As the author noted in his opening statement, the wide availability of prescription drugs within the household is a key driver in abuse amongst teens. However, as the author also noted, less than 3% of households actually safely lock up their medications. One of the groups in support, Core Medical Clinic, has noted that they treat opioid abuse on a daily basis, and the main thing they've seen from their younger addicts is that they primarily got their prescription drugs from medicine cabinets, and so we think this would go a long way in helping to deter this. We believe this pilot program is an important step in measuring and understanding what can be done to curb prescription drug abuse, and with that, we would ask for your aye vote.
Thank you for your testimony. At this time, we're going to take a pause and establish quorum. So, Madam Secretary, call the roll.
Salas.
Salas present.
Bro.
Here.
Baker.
Here.
Bloom. Here. Campos. Here. Chavez.
Here.
Daly. Here. Dodd. Here. Eggman. Here. Gatto. Gomez. Holden. Jones. Mullen. Ting. Wood.
Okay, a quorum is established. Let's proceed. Let me ask for additional testimony and support. Hearing and seeing none, let me ask for testimony in opposition. Hearing and seeing none. Mr. Cooper, well, let me ask for members on the dais for questions. Hearing and seeing none, Mr. You have a question, Mr. Daly? On this bill? On this bill, yes. Please. Proceed.
I just want to really quickly, trying to understand how the mechanism actually works. So if you have somebody who needs that prescription every day, and say somebody that's maybe elder that isn't used to getting into this type of a locked prescription cabinet, how easy is it, functionable is it going to be for them? That's the question I have.
Great question. It's a combination lock. It's a 4-digit combination lock. You just dial it in, and kind of like a master lock. Not a master lock, but rolling combinations, and open it up. So 4 digits are required.
If I may, there's also other types of mechanisms with thumbprints and timers and other things of that sort as well. There's also the program is a patient opt-out, so if there's an elderly person that doesn't see a use for this, then they can opt out of the program.
Thank you.
All right, thank you. And Mr. Cooper, you did accept the amendments on page 4 of the analysis?
Correct.
Thank you. All right, and I think that addresses probably some of the concerns that Mr. Daly raised as well in terms of providing another secure mechanism as well. What we want to do, I think it's a noble cause trying to keep these out of the hands of children. So with that, let me ask if there's additional questions from the dais. Hearing and seeing none, would you like to close?
Sure. What I would add is that a lot of young folks and folks in general do opioids. So they're doing Oxycontin, fentanyl, and other drugs. Eventually, because the cost of pills are about $10 a piece, a lot of folks are turning to heroin now and injecting heroin. And for a long time, the heroin rate dropped significantly. That rate has gone back up now. But who would fathom someone actually using a needle in this day and age to inject heroin? But they're doing that because it's much cheaper than buying these opioids over the counter or stealing them from medicine cabinets. So I would respectfully ask for your aye vote.
Okay. Do I have a motion on this bill? Moved by Ms. Campos, seconded by Mr. Daly. Madam Secretary, please call the roll. Members, this is file item. It was Dodd that seconded the motion? Okay. We will allow Mr. Dodd the credit of being the second on this bill. This is file item number 12, AB 2592. This is a due pass as amended to appropriations. Madam Secretary, call the roll.
Salas.
Salas, aye.
Salas, aye. Bro. Bro not voting. Baker. Baker, aye. Bloom. Bloom, aye. Campos. Campos, aye. Chavez. Chavez, aye. Daly. Daly, aye. Dodd. Dodd, aye. Eggman. Eggman, aye. Gatto. Gomez. Holden. Jones. Jones not voting. Mullen. Ting. Wood. Wood, aye. 9-0. Motion.
All right, that measure has 9 votes. It's sufficient to move on. We'll hold the roll open for additional members.
Thank you.
Thank you. Okay, let's move to the other author I see in the audience, Ms. Bonilla. Okay, so this is file item number 1, AB 1774. If you'd like to proceed.
Good morning.
Morning.
Well, I already have 2 bills out, so it's a good day. I present to you AB 1774, which deals with clinical laboratory licensing in the state of California and the incompetence of the Laboratory Field Services, the entity responsible for its regulation and oversight. Labs in California are currently duly licensed by state and also the federal government. In the state auditor's September 2015 follow-up audit of the Laboratory Field Services, LFS, she recommended that the legislature repeal state laboratory licensing because of its highly duplicative nature with federal oversight. She also noted that Laboratory Field Services has been exceedingly deficient for more than a decade, while the federal government has robust and well-maintained systems to ensure compliance. The state auditor conducted its original audit of Laboratory Field Services in 2008, which LFS never responded to. The auditor then conducted a follow-up audit in 2015, in which she found that very little progress had been made to implement her 2008 recommendations. Although state law has required inspection of out-of-state labs since 1996, it did not begin inspecting them until 2014. In that year, it failed to inspect 93% of out-of-state labs. LFS is also severely negligent on inspecting in-state labs. For example, of the 250 labs that were assigned to the Richmond office, only 8 were inspected over a 2-year period. The LFS has also demonstrated problems with its proficiency testing program, its sanctioning program, and complaint inspection. Also, it sits currently on $12.6 million in fees that it has collected over these years while not doing any of the inspections. And these are fees from the licensees. AB 1774 implements the well-thought-out recommendation of the state auditor. It leaves personnel standards intact and allows for the state to enforce those standards. It ensures that Californians receive the high level of consumer protection needed, and it makes government more efficient and serves the regulated community in a more honest and streamlined fashion. In fact, it was a constituent who brought this issue to my notice, a pathologist in my district. As we move forward in this discussion, I'm happy to take the committee amendments, which will allow us to continue to work toward a final resolution where we can ensure that state-specific standards are enforced, yet duplicative regulation is reduced. The Speaker this year has charged us with prioritizing oversight of state government. AB 1774 takes that charge seriously, with the ultimate goal of creating a mechanism to protect consumers while reducing the inefficiencies in our state agencies. I have Bob Ackerman, representing the California Society of Pathologists, here in support.
Thank you. Please, testimony in support.
Good morning. There we go. Bob Ackerman with the California Society of Pathologists. Pathologists are physicians who specialize in laboratory medicine. We very much appreciate Assemblywoman's efforts in this regard. It is time for reform of a program that currently is not working or completing its functions. In 2009, this legislature passed SB 744 by then Senator Strickland that increased laboratory licensing fees dramatically to solve the problems that we're talking about today. Part of that compromise was not only to raise the fees, but also to recognize and utilize outside accrediting organizations like the College of American Pathologists, the Joint Commission on Laboratory Accreditation, and to allow the department to focus on those labs that did not seek accreditation on a voluntary basis and to focus on personnel standards. Those organizations, both the CAP and JCO, applied. The CAP's application has been pending for 4 years for review. They've been approved by CMS for more than 10 years as an accrediting organization. JCO's application is pending for 2 years. So it's clearly not working. We support the personnel standards that exist, want to make sure they're enforced. The accrediting organizations can implement and accredit for personnel licensing standards. They're required to follow state law. So for those that oppose this legislation based upon some perceived lack of implementation or enforcement, it doesn't exist. And I think the accrediting organizations are very worthwhile and willing to incorporate additional safeguards to address those concerns. So with that, we ask for your support.
Catherine Austin Scott, representing the California Hospital Association. We also are in support of this bill. We have many labs in our hospitals and hospital clinics that depend on efficient service, and unfortunately, we've not received that recently from LFS. We are in support of both the bill in print and the amendments moving the bill forward, and would repeat the comments made by Mr. Ackerman related to accreditation. We're accredited in many forms. It allows us to not only make sure our hospitals meet standards, but also meet best practices. The accreditation process is a two-way process that improves our hospitals' operations at the end of that process rather than just focus on minimum standards. It continues an ongoing dialogue of best practices as well, and we encourage accreditation in our environments. For that, we ask for your support.
Thank you. Additional testimony.
Mike Robeson here on behalf of Quest Diagnostics, which is the largest clinical lab in the state. And as noted earlier, we supported the fee increase bill from 2008 or 2009, and the additional fees that Quest has been paying over the years have yielded no service for those increased fees, and we think Ms. Bonilla's bill is a very reasonable response to the auditor's report, and would highly encourage everybody to actually look at the auditor's report. And it's quite a read, actually, and we support this bill and would look forward to working with the policy committee staff and Ms. Bonilla going forward to work out any the complexities of licensure and the personnel standards and whatnot. Thank you.
Thank you. Additional testimony in support.
Thank you. Michael Arnold, representing the California Clinical Laboratory Association and the California Association of Bioanalysts. We are not in a support position, but we do not have any objection to the bill moving forward today. Something needs to be done in this field. As the auditor's report pointed out, we look forward to working with the author. We haven't completely reviewed the amendments that are going into the bill today as yet. But we look forward to working with the author as the bill moves forward. And just a note of congratulations to your staff, Mr. Chairperson, for the excellent analysis of this bill that was done.
Thank you. Additional testimony.
Amy Durbin with the California Medical Association in support.
All right, thank you. Let me ask for additional testimony in support. Hearing and seeing none, let me ask for testimony in opposition. Okay, please proceed.
Mr. Chairman, members of the committee, Shane Gussman on behalf of the Engineers and Scientists of California, which represents clinical laboratory scientists. We do have an opposition position to the bill as it's in print. We haven't reviewed the amendments, and we will do so. I think our perspective is we share the author and the proponent's frustration with the department's enforcement. However, I think we differ in philosophy about the approach to fixing it. And we certainly will continue working with the author, and would like to thank her and her staff on doing a fine job and working with us, and hopefully we can come to a resolution. Thank you.
Thank you. We look for your feedback once you review the amendments. Thank you.
Mr. Chair, member Sarah Flocks from the California Labor Federation. We also represent personnel in clinical laboratories. We share the concerns of my colleague from IFTPE, but have been working with the author in her office and are very confident that we're going to come to a resolution. So we would hope this bill continues. Thank you.
Thank you. All right. Additional testimony in opposition. Hearing and seeing none. The bill's been moved by Mr. Daly. It's been seconded by Mr. Bro. Let me turn it to members on the dais for questions. Hearing and seeing none. Ms. Bonilla, let me just say thank you for taking the auditor's report and actually following up with it and turning it into legislation to create that accountability that we want, and accepting the amendments and the analysis that help do that and help further that goal. Would you like to close?
Yes, thank you very much. Well, we found out that LFS is actually very efficient and effective at collecting money, but they can't do their job. So this bill does try to address that, and of course we are balancing consumer protection. We want to make sure all the licensees really are doing their job correctly and that there are no violations. And so we are on the path to figuring out, I think, a very balanced and fair solution.
Mm-hmm. Thank you, Ms. Bonilla. This measure is due pass as amended to appropriations. The chair recommends an aye. Madam Secretary, call the roll.
Salas.
Aye.
Salas, aye. Bro.
Aye.
Bro, aye. Baker. Baker, aye. Bloom. Campos. Campos, aye. Chavez. Chavez, aye. Daly. Daly, aye. Dodd. Dodd, aye. Eggman. Eggman, aye. Gatto. Gatto, aye. Gomez. Holden. Jones. Jones, aye. Mullen. Ting. Wood. Wood, aye. 11 to 0.
All right, 11 to 0. That measure is out. We'll hold the roll open for additional members to add on. Thank you.
Mr. Chairman, I'd make a motion to move the consent.
Yes. We have a motion to move the consent calendar by Mr. Bro, a second by Mr. Dodd. Thank you, Mr. Dodd. Please call the roll. There's two bills on consent. File item number 11, AB 2560. File item number 13, AB 2672.
Salas.
Aye.
Salas, aye. Bro.
Aye.
Bro, aye. Baker.
Aye.
Baker, aye. Bloom. Campos.
Aye.
Campos, aye. Chavez. Chavez, aye. Daly. Daly, aye. Dodd. Dodd, aye. Eggman. Eggman, aye. Gatto. Gatto, aye. Gomez. Holden. Jones. Jones, aye. Mullen. Ting. Wood. Wood, aye. 11 to 0.
All right, 11 to 0. The consent calendar is out. We'll hold that roll open as well. Let's go ahead and move to Mr. Gordon. Thank you for joining us, Mr. Gordon. Mr. Gordon will be presenting on file item number 14, AB 2744. Please.
Thank you, Mr. Chair and members. Existing law prohibits the offer of a commission as compensation for referring a patient. It is currently unclear whether this applies to online vouchers for services offered by healthcare professionals. Unfortunately, this statutory scheme predates by several decades and never envisioned the currently available online advertising opportunities. In the past, if a healthcare professional wanted to advertise for his or her services, they took out an ad in the Yellow Pages or the newspaper. They purchased space on a billboard, or they ran a commercial on radio or TV. In each of these instances, the advertisement could also include a coupon or special offer. Technology has now made it possible for a healthcare professional to advertise online and provide opportunities to purchase vouchers for services in online marketplaces such as Groupon, Living Social, and others. Due to the fact that current law does not recognize these online marketplaces, AB 2744 would clarify that online advertising involving the purchase of vouchers for services offered by a healthcare professional is not a referral of patients. I respectfully ask for an aye vote.
Thank you. Testimony and support.
Thank you, Mr. Chair. Members, Robert Callahan with the Internet Association. Pleased to sponsor and support the bill. The point of the bill is to provide clarity where there currently is a little bit of ambiguity. Currently, a statute that predated online e-commerce could potentially be seen as prohibiting some of these advertisement, which doesn't make any sense in the context of the real world. So when a internet user goes to a company site like Groupon or Living Social and is looking for a discount coupon on some elective healthcare services, they are in no ways under the impression that they're receiving a referral from a medical doctor, which was sort of the underlying purpose of the original statute. So this bill is important for our member companies from a precedential standpoint. We don't want internet advertising to be seen or categorized as some kind of referral, and also will provide that certainty for the service providers that they won't be running afoul of the original statute. So we would urge your aye vote. Thank you.
Thank you. Additional testimony and support.
Good morning, Chairman Santlis. My name is Brock Wanless. I'm with Groupon out of Chicago. I'm here in support of AB 2744. This is a much-needed bill that would clarify any ambiguity in the current statute concerning paid referrals as it relates to the Groupon business model and other internet companies. We strongly encourage the support and passage of this legislation that would remove any ambiguity in that regard. Thank you.
Thank you. Additional testimony and support. Hearing and seeing none. Let's go with the tweeners and those in opposition.
Beth Capel on behalf of Health Access California. As this bill was originally introduced, we had some fairly serious concerns with it. However, we've been very pleased to work with the author and the sponsors. The bill that is before you addresses those concerns and makes sure that this legislation is not crosswise of the Knox-Keene Act, which was not ever the intent. So we appreciate the amendments in the bill. Thank you.
Thank you. All right. Additional testimony in opposition. Hearing and seeing none, let me return it to members on the dais for questions. The bill's been moved by Mr. Bro. It's been seconded by Mr. Daly. Mr. Gordon, would you like to close?
Respectfully ask for an aye vote.
All right. Thank you. So this measure, file item 14, AB 2744. This is due pass to appropriations. It's been moved and seconded. Madam Secretary, call the roll.
Salas.
Aye.
Salas, aye. Bro.
Aye.
Bro, aye. Baker.
Aye.
Baker, aye. Bloom. Campos. Campos, aye. Chavez. Chavez, aye. Daly. Daly, aye. Dodd. Dodd, aye. Eggman. Eggman, aye. Gatto. Gatto, aye. Gomez. Holden. Jones. Jones, aye. Mullen. Ting. Wood. 10 to 0.
All right. That measure has 10 votes, sufficient to move from committee. We'll hold the roll open for additional members. Thank you.
Thank you.
Yeah. Okay, at this time, let's go ahead and move to Assemblywoman Baker. Are you ready? Okay, let's move to Assemblywoman Baker. Members, this is file item number 8, AB 2486.